is today. Hello, guys, and today we start the great and physiological features of different organs and systems it mean anatomical and physiological features of some organs in children. It means that we're supposed to tell so today we are talking how skin is different in children of different age. More oftenly in children than in adults. Why the clinical symptoms of skin diseases may be different in children and in adults, even in case of the same type of pathology developed. Then we will talk about the methods of investigation of the skin in children, and we will talk about the semiotics at the end. Semiotics mean the most important clinical science of the skin pathology in children, how it looks like, how to diagnose the most widespread skin diseases. So shortly, it looks like this, the plan of our today's lecture. So why our skin is so important for us? What functions of skin we should remember when we talk about the physiology of skin. So, as you know, skin is the organ responsible for protection. It's our physiological barrier for our organism, and it is the most important part for us to maintain our homeostasis of the functioning of organs and system inside the human body. Sure, it's important to understand that skin is has a function of sensory perception. So, skin is a very important sensory organ. Sure that skin performs a fluid balance, excreting substances, excreting the fluid from the body and some ions, microelements from the body. And like this help to maintain the same homeostasis, but talking about the ion homeostasis. As well, skin is able to produce a lot of different substances. The first substance we remember always when we talk about skin, it is the function to produce the vitamin D. The role of vitamin D in the normal regulation of our metabolic process in our body is difficult to be estimated well, because more we study the functions of vitamin D, more important for our organs and systems it looks like. That is why the function to synthesize the vitamin D performed by skin is extremely important. Temperature regulation, thanks to skin, not just to skin, but mostly to skin, we are able to control our temperature of our body, which is technically, which may balance our normal metabolic processes. Storage function, not just fat as it is on the picture, but storage of of other substances is as well performed by skin. No, and the aesthetic function, it's very known. We are not, we all know about it, about the aesthetic function of skin. That's why we not stay on this topic more, and we go to the morphology of skin. You see, skin, as you remember, has the most important big layers of skin when histology is performed. It is epidermis, derma, subcutaneous tissue, no, and then technically muscle star, so it's not a skin anymore. Why I remind you this? Because you should remember that having different layers means that each layer performs different functions. And histologically talking, skin has much more than 3 layers, because epidermis, look, only epidermis has a lot of layers, like stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum germinativum. Why we are talking about it? Because each stratum performs different functions, and these functions are different in children of different age. And we should not forget about the basal membrane, the membrane between the epidermis and dermis, which is very important, as it is very important barrier between for the substances to penetrate into the deep skin layers. So, skin of a child and adult, is it the same? Sure, not sure. How it's different? Look, first of all, when we talk about histological peculiarities of skin in children, we should tell that adult skin and baby skin has plus minus the same thickness, but layers thickness, each layer thickness are different. For example, epidermis in children is much thinner, but dermal layer is thicker. Why? Because child organs and systems are developing, growing up. It means that all organs which are growing up, which are developing, which continue the process of maturation, need much more nutritive substances, much more oxygen. So it means much more important, rich blood supply. That's why all organs and systems of young child's body have much more important blood supply than in adults. Skin as well. And as we know that derma contains mostly vessels providing this blood supply to skin. This derma is thicker than in adults. Epidermis is thinner. Look on the picture, we can see it. So then we compare the not just thickness of the different layers of epidermis, like on the picture, but we compare the performance of different functions, like because of thicker epidermis stratum corneum layer, thinner, it make for a child organism easier lose the water, the fluid from the body, mean that the dehydration of a child may take place quicker, faster than in adults. Children have lack of natural moisturizing factor produced by skin. It means that the child's skin is likely to be drier than in adults. The quantity of pigments produced by different layers of the epidermis, and pigments are different, not just melanin, yes, well known for us. The quantity of these pigments is importantly lower in children than in adults. It means that the pigmentation of skin in children is less important than in adults and continue to be darker and darker depending on the genetic performance of melanin production. And that's why skin in children is more transparent because it contains less of pigment. It means that you can see easily the vessels of children. It means that you can see easily blood, which is red, as you know. It means that we can see the pink skin of a child, which look like more red, yes, than in adults. So when we talk about adult skin, when there is no pigment, it looks like pale, slightly pinkish. In children, especially of young age, child skin looks like pink, bright pink, and becomes less pink, like more pale with age because of storage of pigments produced by epidermis. It is more about, like more accurate about the different structural changes, features of skin in a different age. Look, skin of children is very different in preterm children. Why? Because the skin is underdeveloped. How it's different? Preterm child epidermis is thinner. Cells are more compressed. The stratum germinativum is widely pronounced. There is almost no pigment there. The skin is extremely transparent. The vascularization is well visible. Skin is covered with lanuga, the hair of newborn child. The sweat glands are not developed yet at all, especially apocrine. Ecrine, they are underdeveloped, but they are present. Term newborn infant has the same peculiarities, but slightly less pronounced, like greater absorption performed by skin because of the position of the blood vessels closer to the surface of the skin, and worse barrier function of epidermis. More importantly, less immature sweat glands, but still immature. That's why the process of producing sweat in newborn children is extremely suppressed. Like, that's why they have no sweat almost at all. It means that their capacity to control their temperature is lower than in adults and in elder children. I should tell that apocrine sweat glands, they finish their development at the teenager period only. That's why only after teenager period we can tell that all glands of skin are developed as an adult. Before, no. Look, mostly apocrine sweat glands start to appear at the age of young child. What does it mean? It is from 2 years old to 7 years old, but mostly yet they are not functional. They start to function at the age of teenager, because what are they? They have receptors for the sex hormones. So while the puberty, they start to produce oil and sweat that more actively. That's why we talk about teenagers, that hyperhydration, it means the overproduction of sweat and oily substances, is very typical for puberty. But it's not typical for young children, especially for infants. So look, what are the peculiarities of newborn skin we should talk about? Upper picture. The newborn skin is extremely likely to be dry because of underdevelopment of sweat, because of underdevelopment of oily substances production. That's why it looks like this. Sometimes we have extreme dryness and peeling of skin of newborn child just after the birth. Especially it's typical for post-term babies. Post-term, it means born later than 32 weeks of gestation, because as you remember, term babies, they are babies born the age 38, 42 weeks of gestation. Then, central picture, it is about the milia. On the nose of a child, you can see the small whitish buttons like rash. It is absolutely normal irritation of glands of skin associated with sex hormones of mother going to the blood of fetus and newborn child while the delivery. So when these hormones are still present and in child's blood, child can have these irritated glands and button-like eruption on the skin. They are whitish, they are not inflamed, so they are not red. And with time, the sex hormones of mother will be destroyed by child liver and will disappear from child blood, and this milia as well will disappear. This peculiarity of skin of a child is called milia. We consider milia as the transitory change of skin typical for newborn, and as you remember, borderline or transitory states like milia do not demand, request any special help. So what do you recommend as a doctor? Nothing special, just perform the routine care of your newborn child. Doesn't matter milia is present or is not present, because it will disappear itself without any help of a doctor. Lower picture, it looks like inflamed buttons, yes, but it is as well transitory state of child skin, which is called toxic erythema. Toxic erythema. What is erythema? Erythema, it is from Greek redness. Erythros, red, yeah. So it is toxic erythema, guys. It appears usually from the second, third day of life and should disappear till the end of the second week of life of a child. But it looks like more dangerous. Why? Because it is the papillus and vesiculus, like elements of rash of a child, and they appear on the inflamed zone of a skin. That's why they are red. It's red. But still, the pathophysiology of toxic erythema is still not studied well. But what we sure about, that we need nothing nothing special to make this disappear. So we do nothing and it will disappear itself without any problems in 1 week, 2 weeks maximum. So you perform the routine care. So this state of skin is called transitory toxic erythema. Even if it looks like dangerous, it's not. Because usually general state of a child in this case is absolutely stable, normal. So child is eating, sleeping, child's behavior is just well, there's no fever, no specific signs of, because technically it is a transitory state of skin and general state of figure. Look, it is there for children of Europe. Same Lanoga, it's just our child is premature, so for sorry, you see the how it looks like the premature child skin. And this child is premature because you see how thin to store some fat. It's important, yes, for child to survive. You just will remember that child in brighter pink skin, transparent skin, without any subcutaneous. So skin is the mirror of our health. It means that children, in case of different diseases, upper picture, it is called cyanosis. Cyanosis, guys, child also local cyanosis or acrocyanosis. Look, like on this picture, child has only or perioral cyanosis around the mouth. So around the mouth just, but all color of skin is pink. It is called perioral cyanosis, local cyanosis. Whole child bluish, total cyanosis or generalized cyanosis. What does it mean for us? It means the child has lack of the oxygen in the organism and too much CO2. And we remember that CO2 molecule joined to the hemoglobin cause changing of this hemoglobin molecule to the blue. That's why more CO2 molecules are present in our blood, more our blood is bluish. That's why venous blood is more bluish than arterial blood. That's why when we have very blue blood, yeah, we have it visible on our skin, especially when our skin is not pigmented. If it's pigmented, we look at the lips, scleras, and mucous membranes. As well, child skin may be erythematose, red, may be yellow. Yellow, it means that other substance is coloring the subcutaneous fat of a child, and the substance is bilirubin. Look how yellow is this child. This child has jaundice. Jaundice, it is a yellowish color of skin, which is associated with storage of inconjugated, mostly bilirubin, into the layers of skin, especially in subcutaneous fat. More subcutaneous fat child has, more important will be jaundice. More bilirubin in his blood he has, more important will be jaundice. As well, color of skin depends of pigment stored. So skin should be pigmented, and pigmentation of the skin depends on the race, depend on some diseases. Sometimes we have hyperpigmentation when quantity of melanin is not enough for this child. It may be local as a spot of hyperpigmentation, which looks like a lighter color of skin locally than usually. Or it may be depigmented when this spot is just white. You know this pathology, usually it's typical for vitiligo. Yes, it is a disease associated with appearance of such a spots of depigmentation on the skin. Or it may be hyperpigmentation, like on the skin we have spot with borders, visible borders, and the spot is darker than other skin. It is hyperpigmentation. It may be difficult for different diseases, for example, for Addison disease. It is the slide where I remind you what may be the causes of yellowish color of skin of jaundice development. We have three most important types of jaundice development. So when we evaluate the child state who performs the jaundice, you think about such as three ways of jaundice development, which are hemolytic jaundice. Hemolytic means caused by hemolysis. Hemolysis, it is a breakdown of erythrocytes. May be normal, like in young newborns. It may be pathological, like in elderly people. Or it may be hepatocellular jaundice caused by the abnormality in work of hepatocytes. It means that the process of conjugation of bilirubin is violated, and process of excretion of the direct bilirubin, conjugated bilirubin, is problematic, becomes problematic. For example, in case of hepatitis, inflammation of liver. So in this case as well, we will see the increased level of bilirubin as well as, and as a consequence, the jaundice. And obstructive jaundice, when hepatocytes technically they're working well, but biliary tract is these passages, biliary routes, they are too small. They have bile duct, for example. These passages, they are small and obstructed by spasm, for example, by some tumor, by congenital abnormality. So being narrowed, it means that their capacity to push the bile to the duodenum is lower. It means that bile stays, direct bilirubin is reabsorbed to the blood, and its level is increased, and it may color the skin of a child to the yellow, like this on the picture. Look here. So next big part of our lecture is about the skin rash. It's one of the most difficult part of today's topic, because skin rash usually is it may be really different in type, in terms of development, and it's not easy to remember different kind of skin rash. That's why I will show you some rash elements to make you remember how it looks like. So how we describe the skin rash? We can use SCALDA as a way to remember how to describe the skin rash. So in SCALDA, it is abbreviation, whereas it is a size, shape, and texture of the element. Size, like up to 1 centimeter, 5 millimeters, 1 millimeter, spot-like, shape, like round or not. Next, C, it is color. Color means reddish, yellowish, pigmented like brown, hypopigmented like light brown, depigmented like white. Arrangement, it's A. L, lesion type. It may be primary or secondary. Later I'll tell you what is a primary or secondary type of that. D, distribution, how it's symmetrical or not, where it is formed, on what substances. Sorry. And A, at the end, it is always check conditions of the mucous membrane, because it's oftenly seen that mucous membrane may be affected as well, and may perform some elements of rash on the mucous membrane, and it is called enanthema. So rash elements, we have two types of rash elements. They may be primary and secondary. Look how they are different. So what do we call primary elements of rash? Primary elements of rash, they are elements which may appear on primary, not damaged skin. So yesterday the skin was healthy. Today there is an element of rash on the primary, not damaged skin. It may be, what this element may be, like spot, which is called macula. It may be like a button, which is called vesicula, when there is a content inside. It may look like tuberculum, when there is an overgrowing of the epidermic layer. It may be fulfilled with transparent fluid, like in case of urtica, for example. It may be hemorrhagic or pigmented. It may be, it may contain the cavity or not. For example, no cavity, but there is a, but it is palpable. It is papilla. Or when it contains the cavity and this cavity is fulfilled with transparent fluid, it's called vesicula. When this fluid is passed, it is pustula. So all these elements are called primary. Secondary skin elements, skin lesions, they are elements which appears after as a result of primary element development. For example, we had vesicula fulfilled with transparent fluid like serum. Then this transparent fluid has a bacteria contamination, and it turns to pustula with pus inside. Then child is feels this itching, yes, and destroy this element, and you have, for example, development of erosion. So erosion, or if it's deeper, ulcer. It is the secondary element of rash, which was developed after the changing of the primary elements. For example, like a scale, like a fissure, like a lichenification, look on the picture, like an atrophy. As well, when we classify the rash elements, we talk about the elements with and without cavity. On the picture, you can see what does it mean. Usually cavity is visible because there is a transparent epidermis upon, and you can see through this epidermis if there is a cavity or not. Usually this cavity is fulfilled with fluid. It may be serous fluid. In this case, it's called vesicula if it is deeper in skin, or urtica if this fluid is not localized in one cavity, but mostly it is edema of intracellular space, or without cavity, like in case of such a maculas in the picture. It is different photos where it is more visible the difference between some primary elements. So macula is just scientific name of spot. Bulla, it is element developed on the epidermis, just so it's very superficial upon the skin, which contains a lot of serous fluid. Papilla, it is an element which may be palpable, but there is no cavity inside. For example, pustula, it is with pus, as I told you. Vesicle or vesicula, it is an element of rash developed in the deeper parts of epidermis and then may even touch the derma. And inside the vesicle, usually you have serous or hemorrhagic content. These lower parts, they are all about the secondary elements of rash, like scale, like crust. Usually crust, it is the result of this content of the vesicle or pustula going outside, yes? Once you destroy the elements containing elements with cavity, you have usually crust appear. Excoriation, when there is an itching, yes. Erosion, when it is a superficial defect of skin. Or scar, when ulcer is healing, the scar appears. So it is a declassification of maculas. And here on this picture, you see non-inflammatory maculas. When there is no inflammation, you know that usually inflammation is associated with red color. Here, these papulas are mostly not caused by inflammation, really, especially up in upper picture, macula. It is white, yes, depigmented maculas on a person who have normally dark skin. And especially on the fingertips, you see how skin lose the pigmentation. It is vitiligo. And lower here figure, it is the monochroid maculas. They are typical for, look, they are darker color of skin, especially on buttocks, especially on the lower part of back. They are typical for newborns, and they will disappear with age. You should not do nothing with this macula. It is just transitory state of skin in newborns. These maculas, which are called petechia, it is reddish, and then purple, and then blue. Then tomorrow it will be reddish, after tomorrow purple, after tomorrow in 3 days blue. It will be small, extremely small spots on a skin, especially, the localization depends on the pathology, which when you press on it are not disappearing, because it's extremely small hemorrhages, like bruises, but extremely small. That's why the color of this petechia, it changed depending on the time when you perform the evaluation of child stage. And the bright child disease associated with petechia is Schönlein-Henoch purpura. When these spots, like petechia or purpura spots, appears mostly in buttocks, in lower extremities. Looks how a lot of of this purpura elements may be present on child skin. This disease is the type of vasculitis, inflammation of vessels. Because of this inflammation, vessels becomes more permeable, and you have such a hemorrhagic disorders, hemorrhagic spots appearance. Infectious exanthema. Some child infectious diseases are associated with exanthema, with skin rash. For example, very known infectious disease of children, of childhood, is chickenpox. Chickenpox or herpes zoster infection in children, acute herpes zoster infection, is associated with high fever during the 3, 4, 5 days, sometimes even more, and appearance of specific kind of rash, where the most bright characteristic, most bright type of rash is vesicle, like on this picture. So these vesicles appear usually on all child body, whole child body, starting from, and in the hair part of head, and all child body may be covered with these elements. And it starts, usually this rash starts at the 3rd, 4th day of the fever, and it's change the type of rash. It starts with macula, with red spot, then it is transformed to the vesicle, containing serous yellowish fluid inside. Then when child destroy this element, we have crusts on the elements, and then it is healed. Other important disease, it is mumps. No, not mumps, measles, sorry. Measles. Measles is the typical disease when child as well has the 3-4 days of fever, and then he has the appearance of different elements of rash on the skin and on the mucous membrane. And what is interesting, on the mucous membrane of the oral cavity, on the buccal part of the oral cavity, we have appearance of Koplik spots. And these Koplik spots, whitish spots, they appear at the 2nd, 3rd day of measles period, and they disappear in fourth, fifth day. But in fourth, fifth day, you have the skin rash appearance. And the skin rash starts from the specific regions on the face, mostly prominent parts of the face, under, not like behind the ears, on the prominent part of the face. Then next day it will be spread on the whole face and upper part of body. Then all body will be covered third, fourth day, and all child is covered with such a rash. It is maculopapulosa rash. Another very frequent disorder of skin in children, it is atopic dermatitis. Atopic dermatitis have two important forms. Of course, one is typical for young children. We call it eczema, and other is neurodermitis, which is typical for elder people. Localization of rash is different. For example, eczema localization in young children, it is mostly cheeks, buttocks, it is mostly neck, arms, and the elements of rash are maculas and fields of erosions and vesicles. And if it is neurodermitis, it is more typical for elder people, elder children, teenagers, and adults. And rash is mostly on the hands and look on the knees. And typical element of rash, the most bright element of rash, is lichenification, secondary element of rash. In case of gastrointestinal tract disorders, the very specific changes of skin are telangiectasias. Look, it is here. Telangiectasia, it's star-like spots on the skin. Yellowish color, jaundice, I have already told about it. And erythema, it's very typical for chronic liver diseases, for cirrhosis, for Wilson. Of some specific testing may be performed, like for example, Zank testing is performed to diagnose herpes virus. Wood light examination may be performed to diagnose pigmentation disorders and some fungal infection, mycosis, which are typical for young children. Scraping testing. Scraping test may be as well performed for fungal infection detection and for scabies diagnostics. Diascopy may be performed when you press. Look, it's very easy. When you press on child's skin and you see that the element is not disappearing when you press, it means that this element is not inflammatory but hemorrhagic. So in this case, it is petechia. And biopsy. Biopsy is performed when there is some tumor-like change of skin, and you think about the tumor, and you want to diagnose what kind of tumor is present in this case. And we have different kinds of biopsy types. And I finish my lecture with a case of a child who, as you see, has 8 months old. It's a girl, and mother tell that this girl has itching, skin rash, while the last 2 months and first elements appeared after tomatoes introduction, in this girl-food ratio. Mother has allergic rhinitis. It means that we have specific allergic anamnesis in this family. Look, the specific localization of Russia's perfume is present like on the cheeks, on the chin, on the face mostly, yes, on the lower part of parts of arms, on the hands mostly, and it is like big lesions of skin rash, inflamed, red ones, yes. They are performed like, they are covered with yellowish crusts, and we think about xerosis as well. It is dryness of skin. So we see erythematous papules with eczematous plaques covered with crusts when we describe it according to the scale, with xerosis, and we think about atopic dermatitis. Thank you for your attention, guys. If you have questions, please ask me. If no, have a nice day. Thank you very much.